first, how many times have you been on the phone back and forth between your insurance company? They tell you to go back to the provider, who tells you to go back to the insurance company, who maybe has a question for your employer, kind of back and forth, back and forth. So then you go home and are still Googling to kind of fill in the gaps. Wait, what were the side effects? What was that name of that medication again? Oh, did I even see the right provider, or should I be seeing somebody else? Now imagine kind of an alternative, right? While you're in an experience, there's an assistant on the side, kind of filling in those gaps in your understanding. If the provider says a name of a medication, which is a long word, the assistant is telling you what that is in layman's speak on this. And AI, especially some of the newer methods, is giving us the ability to create kind of the healthcare experience that people deserve.
Welcome to Building with AI, the show where we engage in conversations with world-class AI product builders and leaders. We help uncover tactical insights to help you build and scale better AI products. I'm your host, Hamza Choudery, and today I'm joined by Jayodita Sanghvi, Senior Director of Data Science at Included Health. Jayodita completed a PhD in Bioengineering at Stanford before jumping in industry with the goal of raising the standard of healthcare for everyone. In her current role leading data science at Included Health, her team uses AI to simplify healthcare for users by providing services like clinical care and specialist recommendations. During the episode, we discuss how LLMs are going to improve healthcare delivery, why Included Health relies primarily on prompt engineering, how to get the most out of early adopters by using them for feedback loops, regulation and bias considerations for AI in healthcare, and much more. But before we dig in, here's a quick word from our sponsor. Autoblocks is a leading AI evaluation platform for product teams. It enables your team to collaboratively iterate on prompts, model parameters, and RAG parameters, while letting you retain full control over whatever frameworks or tech stack you want to build with. Seamlessly run tests to evaluate the impact of product changes on quality. Learn how to ship more reliable LLM products at autoblocks.ai. Now, back to the episode. Jayodita, welcome to the show.
Hi, Hamza. Thank you so much for having me. I'm super excited to be here today.
Likewise. Just to kick things off, can you tell us a little bit more about yourself and specifically what drew you out of the world of academia into the health tech space?
Would love to. So, hi, everyone. My name is Jayodita Sanghvi, and I lead data science at a health tech company called Included Health. And there have been three things that have primarily motivated my career thus far. The first is that I'm just really driven behind the mission of helping to improve human health. It is because I wanted to have the opportunity to make an impact in human health that I chose to do my training and education in biology and bioengineering. And since I have moved to the health tech space for that same opportunity. The second driving factor for me is that I've always been interested in really complex systems, understanding those systems, and then figuring out how to optimize those systems and make them run better. So, for example, in my PhD, I built the first ever gene-complete statistical model of a living cell. We took the whole system apart and then put it back together again to really understand how every little part of a living cell worked and functioned together. Now, that sounds like a mouthful, but I promise it was really fun. But we got an incredibly in-depth understanding of this basic unit of life. And what was exciting was then, once we had it all assembled, we could start to play with it and tune it and see what we could do to make it grow even faster and even better. Now, the U.S. healthcare system is also a very complicated system. It is really hard to understand how the payments models work, how the provider systems work, how to actually access high-quality care. And so it has been really fascinating to move into healthcare to try to unpack and improve this system. And this is what I've kind of been working on for the past decade or so. And now the last kind of motivating factor for me has been taking new methods and new technology and figuring out how to apply it to new spaces. So, for example, as an academic, I took a lot of the statistical and computational modeling constructs from other disciplines. We mixed a number of methods together and applied them into kind of the cellular biology space that we were working in for the first time. Right now, I'm super excited and interested in how we can apply some of the latest methods in AI to healthcare navigation, to healthcare experience, and to healthcare delivery.
Incredible. And before we dig into more of your insights on integrating AI into Included's product, I'd love to hear a bit more about the application. How do users actually interface with Included Health? What is the product?
Yeah. So in Included Health, we essentially want to hold your hand through that very complicated US healthcare system and make it easy and understandable, right? So if you think about it today, the healthcare system is kind of a slog, right? You kind of avoid it until you or your family member really needs it. And at that point in time, what you're thinking about is who is accepting new patients? Is this covered? When is their next appointment? Is this even the right type of professional for me, et cetera? And it's hard to get through that much. Instead, what I might argue the right questions are, is this provider actually good? What is their track record? Have they seen patients like me? Will they help me get better? Will I feel listened to? Will I feel heard? And so that's the gap, right? Because even if you ask that second set of questions, there's not really the information required. And so that is a gap that we at Included Health are trying to fill. We are the phone number on the back of your insurance card. You call us or you chat with us, you log on to our app. We help you with first the logistical burden of healthcare. So we will help you answer those questions about, is this covered? Help me understand my bill, et cetera. But then we will walk you through your clinical needs as well. We are a healthcare clinic. We have staffed clinicians and physicians in primary care, behavioral health, urgent care, and chronic disease management. And then as your needs grow beyond those primary needs, we also help guide you to high quality specialty care through our extensive provider matching tool. So this is a AI built tool where we've got over 200 models kind of on the provider side trying to discern differences in their practice patterns. What are they good at? What are they safe at? What is their experience in? As well as models on the member side that are trying to understand their needs, their values, their preferences. And then we do an optimization problem, putting these two things together, helping guide our members to the highest quality providers for their needs at this very specific moment, kind of moving down the member's journey. We've also recently launched some specialty care modules at Included Health, where our own staff will further help guide you through your complex medical journeys. And lastly, we deliver expert second opinions, where we would collect your whole file of records and send it to a leading expert in your area of need. So in doing so, we really are this end-to-end integrated solution.
And do patients typically come directly to Included Health? What's the typical journey to discovering your product?
That's a great question. So we do have a few different business models. Our primary business model is that we're in the employer space. And so we will partner with medium to large employers, and we will become a part of their benefit package, which means that all of their employees and their dependents would have access to the Included Health benefits.
Awesome. Now I'd like to segue over into the AI space. You've been in the space for quite some time now, both in academia and building AI products that Included Health for years now. I'm curious to hear about how you interpret the advent of large language models and what gets you so excited about GenAI.
Great questions. Thank you for asking this, because I think you're absolutely right. There's a ton of buzz around AI at the moment, but AI itself isn't that new. So Included Health has been using machine learning, deep learning, data science for at least a decade. And a lot of our digital products are really based in this technology. For example, our provider match tooling, which again uses hundreds of machine learning models to understand differences in provider experience, it helps match members to the right providers for their current needs. What is new in the space is generative AI and LLMs. And I am excited about the use of LLMs in healthcare because LLMs basically take very large and complex amounts of information and return responses in summarized, understandable, and simple forms. And summarized, understandable, and simple is exactly what healthcare needs. Today, healthcare is an obscure black box. What the patient needs is a better way to understand their complicated conditions and treatment paths. The patient needs to understand what providers do and what they are good at. The patient needs to understand complex payment models. And so there's a big opportunity to take what today is very scary and complex in healthcare and turn it into something that's accessible and understandable such that patients can feel more empowered as if they're actually controlling their own destiny. You also asked what gets me most excited for kind of the potential of AI in healthcare. Today, disconnected information is why the healthcare experience is also so disconnected. And AI, especially some of the newer methods, is giving us the ability to create kind of the healthcare experience. So where are those disconnections today in the healthcare system? First, how many times have you been on the phone back and forth between your insurance company? They tell you to go back to the provider, who tells you to go back to the insurance company, who maybe has a question for your employer, kind of back and forth, back and forth. Information in the payment side of the system just does not seem to flow properly across the various parties involved. Second, every single time you see a healthcare professional, it feels like a new and independent experience, right? Think about how many times you fill out forms over and over again, or have to re-explain kind of your past to a provider kind of when you're visiting them. Again, your own history of your medical journey does not flow very nicely. And think about how often kind of you are listening to your providers, understanding kind of what they're telling you, but it's not everything that you need to know. So then you go home and are still Googling to kind of fill in the gaps. Wait, what were the side effects? What was that name of that medication again? Oh, did I even see the right provider, or should I be seeing somebody else? Right? There's kind of, through all aspects of how we're trying to get care, just missing information, disconnected information. Now imagine kind of an alternative world, right? While you're in an experience, there's an assistant on the side, kind of filling in those gaps in your understanding. If the provider says a name of a medication, which is a long word, the assistant is telling you what that is in layman's speak. Imagine that same assistant sitting on the side of your provider's kind of interface. It's complete with a very easy to digest kind of history of your medical journey so far, giving them the context that they need about you, or even context about medical literature that they need to help treat you. Assistants kind of helping to connect providers to the insurance companies and the payment systems in more connective ways. And then a lot just sitting under the hood, where you don't even need to understand that information, but it's constantly processing and filling in the gaps, right? There's a world in which these parties and the many, many parties required to deliver healthcare kind of come together much more seamlessly because they're seeing and understanding and conceptualizing the same things. And I think that's what AI can get us.
Awesome. So it's been over a year now that LLMs became mainstream. I'm curious to peel back a layer and hear about how Included Health initially started experimenting with large language models, how you initially scoped out the use cases that you wanted to go after.
Yeah, it's been definitely a fun year kind of getting to play with this stuff. Included Health really values how amazing our care and clinical teams are. And the human touch is always going to be a huge part of our experience. We're not taking the approach that a lot of the hype suggests of chatbots taking over everything. Instead, for us, the question is, how can we use LLMs to empower our team? And this has been the guiding principle as we've chosen what efforts to go after. We also want to learn about this space, which is rapidly evolving. And so another pillar of how we've chosen our initial efforts are those which are not only simple, but kind of at the core of kind of major areas in which we work so that the learning opportunity is high for us. So easy examples of where we have started have been auto documentation tools. for our staff. So they can actually look at the members, engage with them while the summarization of the interaction is happening on the side. And we're able to actually get better and more complete logs of the interactions. Our team also spends a lot of time answering a lot of kind of basic run-of-the-mill questions. We're trying to see if we could self-serve the answers to those more basic questions so that our team can then focus on the more nuanced questions. We find that the simpler the question is that our member has, they're also expecting a quick and easy answer, right? And so that's not the situation where they want to be on hold for a long time. So instead, a self-serve capability enables them to get kind of that quick, accurate experience that they're looking to achieve.
Got it. And can you touch on the team composition for building these GenAI products?
Yes, it has been super interesting, right? So you say AI and you immediately think data science team, who are, of course, our data scientists and machine learning engineers are absolutely involved with these efforts. But it's been fun to see how the whole company has really come together to deliver these efforts. So first, just within our technical organization, we find that really every effort that we're taking on has to be a collaboration between data science, engineering, design, and product, because so much of what we're building is an experience. It's not just a model, right? It's an experience that our kind of members or our internal teams are going to be interacting with to make either accessing healthcare or doing their jobs more seamless. And so kind of the back and forth with our design and product teams has been essential to kind of make sure that the whole product end to end, it really is creating that right experience. Now, beyond that, a lot of our applications are in service of or empowering our care and clinical teams. So they have been incredible partners in all of this work, kind of users and enablers of a lot of this technology as we run through. And beyond that, as we're working with LLMs and there's a new regulation space, we work a lot with legal, security, privacy, et cetera. So it's been a fun ride because we've been able to kind of talk with and work with pretty much most of the functions at the company.
Yeah, it's really awesome to see companies really rallying around this moment. Is Included Health using API model providers like OpenAI or training its own large language models?
Yeah, that's a great question. We are using kind of the license models out there, but one of the big parts of our strategy is actually giving ourselves the opportunity to play with a number of the different models that are out there. And so we have invested in building a centralized platform that kind of handles a lot of the procurement, the security, the privacy, even some of the analytics tools, et cetera. So we kind of think of it as giving our product and application teams so they can quickly spin up all the different models and kind of see which one is performing better, which one they are able to better tune for the application at hand. And then given that it's such a rapidly evolving space, when we do have to make changes, we can make those changes in one central space.
Got it. And when you contemplate various techniques like prompt engineering, fine-tuning, RLHF, how do you think about the trade-offs between these techniques? What have you been using primarily at Included Health?
Yeah. So we are still very new in kind of learning how to use this technology. And so right now we are starting with as lightweight of an approach as possible, mostly because that will enable us to test things out faster, maybe get to market faster. We have found that using a lot of the off-the-shelf LLMs combined with prompt engineering, some grounding, and then, of course, strong safety guardrails has been highly effective for the initial use cases that we've been working on. It does provide kind of a practical and efficient solution without the need for extensive custom development. But we are still really early on with a lot of this work. So it is going to be interesting to see kind of when we hit the limits of this method and kind of when we would move on to more advanced approaches, such as the fine tuning.
Got it. And double clicking into prompt engineering, I know you mentioned that AI product building is very collaborative within Included Health. Who's spearheading the prompt engineering efforts? Is that collaborative as well, or is it being spearheaded by a specific team?
Yeah, that's a great question. And it depends a little bit on what the application is that we're building. So there is definitely is a combination and collaboration definitely between data science and our product teams, but often our care teams and our clinical teams as well, based on the application. One fun example here is that we've also been building kind of tooling for our internal purposes and employee productivity. For that, we actually put out a competition and we had different users of our internal tool build their own assistants for whatever their day to day look like. So they did their own prompt engineering. And we actually found some very cool applications come out of that. For example, a design assistant, a meeting summarizer, a lot of software development tools, et cetera. And so it's been fun to kind of put it in the hands of various people around the company.
Awesome. And I know you touched on some of the challenges of building with generative AI, and a theme that we hear time and time again is that the non-determinism of these models is one of the primary challenges. I know that having a human in the loop is one of the primary ways that you mitigate risks at Included Health. Can you touch a bit more on testing and evaluation and what that really means? Evaluation is a very hot topic in the AI space, but would love to hear your thoughts on what that means in practice.
One of the interesting things about kind of creating these new experiences for our members is that they are new experiences for our members. And so if we're saying, hey, take a system like healthcare, something where you're very used to a very kind of in-person experience, on the phone experience with pairs, et cetera. And we want to change that now into a more kind of chat-based digital experience. This is a change for everyone interacting with the healthcare system. And so what I think we're going to see is a massive feedback, right? So you're going to see early adopters, people kind of starting to kind of test the waters of whether they like a chat-based experience. Then they're going to have one or two really good experiences with that to kind of get hooked to it. Then we will have to learn from, okay, what are those things that they're getting hooked to and maybe coming back for? Those are the areas that we're going to want to build out more and more then and kind of add more AI capabilities for, and then kind of that feedback loop hopefully keep going as people make that transition from a very old way of interacting with the system to this newer way of interacting with the system. And as kind of that loop drives kind of time and time again, we're going to have to continuously refine kind of not only the underlying models, but the experience that comes along with it to make sure that it is what the members require to kind of, again, ultimately have that seamless experience that gets them to the better.
Awesome. I'd like to shift the conversation a bit and talk about AI regulation for healthcare and your thoughts on that.
It is a super interesting space. I will admit that I've been spending a lot of time with friends in kind of the legal space, as well as our own internal legal team, and it's fascinating. I think there are a few areas in which we're going to see regulation come up in this space. One will be about in the area of security and privacy. Honestly, I think that is paramount. That is not a place to cut corners. We're already seeing Included Health really spending the time on making sure we get that right. For example, kind of at the highest level, nothing that is Included Health data, especially our members' health data, can ever cross the wall to the other side. That always needs to stay on our side. And we actually go very slow through our due diligence to make sure that is absolutely so. For instance, it was actually frustrating. It took us a while to get access to OpenAI, but it was because we were really making sure that we had all the right BAAs and everything in place before we made that leap. The second place where I think you will see regulation come up is in the area of bias. That one is super interesting because it is not going to be black and white. And we won't even have all of the data required to do every possible check. And so it's going to be a game of due diligence and really being able to do as much as humanly possible in terms of testing for bias and correcting for bias, given what we have. And I'm quite excited to see how regulation kind of deals with the nuances that are going to be associated in that.
very insightful. And how do you think about bias and how that plays into AI experiences that you're delivering to patients?
Yeah. One interesting thing about healthcare is that already today, healthcare is biased. Not everyone in the United States has access to the same quality of care as others living in other regions. And so, one of the interesting things that I think AI poses an opportunity for is maybe a tool to help reduce some of the bias in access to care and help kind of bring everyone to higher clinical outcomes. Our provider match tool is a great example of something trying to do exactly that. What we find is people living in kind of various care deserts, et cetera, have a harder time knowing who to go to and kind of who would be able to give them the right care for their needs. Our matching tool helps them kind of find those people who would be best for their needs in their areas. And then we supplement that with a lot of virtual care to kind of bridge any further gaps that might exist. I think with AI's ability to kind of have kind of even more kind of virtual and digital interactions, bridge information together in a greater way, it's going to help us kind of bring information and access to people kind of in different pockets of the country and potentially help bridge a lot of the gaps that we have. Another trend that we're seeing is that there is a low supply of physicians at large in the United States. And so I think there's an interesting promise of kind of what can be digitally delivered, kind of what are those easy questions that kind of we could have AI assist with. So you're saving the time of those few professionals that we have for where their insights are really going to matter in kind of the nuance of various member needs. And so I'm actually really interested in how we can use AI to almost push our system to be less biased.
Awesome. And zooming out a bit, I'm curious to hear your thoughts on the battle between incumbents and startups when it comes to innovating with Gen AI in healthcare.
This is a really interesting question. I think I'm betting on both. The nature of progress is going to be interesting. So let me explain a bit. So it does keep me up at night that there will be some early stage startup, maybe in the place where Included Health and Grand Rounds was about 10 years ago, that's just tinkering and trying stuff out, bold stuff, because at that stage, all you care about is finding that golden idea. And maybe 20 startup companies will try, but it only takes one to succeed that will really start to cause waves in kind of the use of AI in healthcare. I really do imagine that there's going to be a lot of innovation in the chat-based experiences of healthcare, how members are going to be able to access content and do digital monitoring. So yes, I have no doubt that a few of you out there are going to come up with something very, very cool. But there's another trend in healthcare today, which is that integration is the name of the game. Kind of from both the healthcare experience standpoint, as well as impacting the total cost of care standpoint, the ideal solution is going to need to be able to play in the logistical aspects of care, in the navigation aspects of care, in primary care, in behavioral health, and specialized care. And so it is the companies it's the company that's going to take the seams out of all of those different things that I just said and turn that all into one experience that I believe is going to win. And that kind of making it seamless is also going to be something that's going to be AI enabled. But the incumbents have a better shot at this because they already have those products and partnerships that cover this broad landscape. And again, I'm bullish on AI being the thing that's going to help fill those gaps between all these different point solutions and be that connective tissue that turns disconnected healthcare into a single experience. And so we're going to need a little bit of both. And so the way I've been pushing the team is actually using the phrase, how can we reserve the thought process and capacity on our team to almost have a garage startup within our now larger company? We really need that. Just try the kind of high risk, difficult things while integrating this journey for the members. And I think those two things coming together is going to win.
Awesome. And do you bifurcate those efforts amongst different team members? How do you think about maintaining accountability for some of those bigger swings, riskier swings?
Honestly, it's hard, right? Because you kind of have to deliver the amazing experience that we deliver to our members every single day. And we're never going to kind of drop the ball on that while constantly pushing on the new and the forward looking vision. So it's all about balance and making sure that we kind of strike that right balance across not only our technical teams, but the company at large.
I'd love to hear about your thoughts around the relationship between traditional machine learning models and large language models, and if you see those continuing to integrate into cohesive systems, or are we going to see those continue to be productized in distinct ways?
Yeah, I think that's an interesting space. And honestly, in many ways, only time will tell. The thing we used to say back, kind of before LLMs and generative AI became a huge thing was you don't need to add complexity just for complexity's sake or just to kind of use the fancy buzzword. So if the simplest kind of logistical regression is going to work for the application that you have at hand, start there, right? And kind of add complexity as it's merited. And so I am kind of excited to see kind of as we play out some of the newer applications in healthcare, kind of what that the interplay is going to be with kind of sometimes you just need something simple and sometimes you really need to be able to access kind of large corpuses of information. And yeah, I think that there will be creative souls out there who figure out the right balance of using all of it together.
Awesome. And I know you mentioned that there was some frustration when you were waiting for the BAAs to get signed and waiting to get your hands on these large language models. But for a larger incumbent, I would say that Included has been fast to act on this latest wave of Gen AI compared to some other players that we've seen in the space. I'm curious to hear about how this was championed internally. Was this a top-down initiative or was it different than that?
Yeah, that's a great question. First of all, I would just love to tout the data science team that I get to work with every single day. Literally the most intelligent and innovative group of people I have ever met. And so I do think that it was a combination of kind of a lot of ideas coming out of kind of the data professionals at the company, but also well balanced with a lot of top down kind of push in the same direction. And I think it was nice that those two things came together, which really did enable us to move fast. So one story kind of on the kind of bottom up side of things, I was very impressed with how the team read the tea leaves and really saw that this was going to become a thing and a capability that our company would need kind of very, very early in kind of the time in which LLMs were being announced. And even before kind of there was a top-down decision that we really are going to invest in the space, we had already started to build out a core platform that would enable us to kind of test and try and easily implement LLMs into various applications. And so kind of as kind of we're able to procure more and more of this technology and really get the ground running with our applications, we already had a lot of that base built. And I think this was just a really smart way of kind of strategically making sure we stayed ahead of the curve. At the same time, there has been nothing but support from kind of top down in kind of wanting to invest in this technology. Just last week, I was in a meeting with the CEO where he once again said, AI is not going away. I am still kind of betting on that technology that is going to empower what we do as a company.
Awesome. And this has been such an insightful discussion. We'd like to close off with any hot takes that you might have on the AI space, any contrarian takes for our audience.
I think that, there is a lot of buzz and fear and hype in the space. You read a lot of articles where they're like, AI is going to take over the world. I still think we have a lot of space and time for innovation where, the AI is empowering the human and the human is empowering the AI, and we're figuring out kind of how that flywheel works. There's so much low-hanging fruit left to make not only healthcare better, but so many other kind of the systems that we interact with on a daily basis that today I'm sitting here with optimism.
Jayodita, thank you so much for all of the insights. It's been a pleasure. I'm sure our audience is really going to enjoy listening to your POV on the AI space.
Thank you so much, Hamza. Thank you for having me. I have really enjoyed the chat and really appreciate you having me on the show.